What if I told you that the pill you swallow every morning to protect your heart, the one your doctor told you is the gold standard for your blood pressure, might actually be doing absolutely nothing for you? Or worse, what if it's working just enough to give you a false sense of security while your arteries are still under a constant, silent attack? I know that sounds like a bold claim. You've been told for years that as long as you take your medication, you're safe from the risks of stroke and heart failure. But there is a massive gap between taking a pill and actually controlling your blood pressure, and for millions of seniors, that gap is where the danger hides. Today, we aren't just talking about numbers on a cuff. We are talking about the subtle, often ignored warning signs that your medication is failing you, the brand new clinical data that explains why some bodies simply reject these drugs, and the specific things you need to look for before your next checkup. By the end of this video, you're going to know the 5 definitive signs that your blood pressure medication isn't working, why your normal reading at the doctor's office might be a total lie, and what the latest 2026 research says about how to actually get those numbers under control for good. This is information your pharmacist likely doesn't have time to explain, but it's information that could quite literally save your life. So stay tuned, because this one is critical. Hey, welcome back to the channel. If you're joining us for the first time, this is where we break down the latest science in longevity and heart health specifically for the over 60 community. We don't do hype here, and we don't do miracle cures. We look at the data so you can make informed decisions about your health. Today, we are tackling a topic that hits home for nearly half of all adults in the United States: hypertension. Specifically, we're looking at why, despite 700 million prescriptions written annually for blood pressure meds, the rate of heart disease is still climbing. Recent studies have shown that up to 50% of people on blood pressure medication do not actually achieve their target blood pressure. That is a staggering statistic. It means half of the people following the rules are still at risk. To understand why your medication might be failing, we first have to understand what it's actually trying to do. Think of your circulatory system like the plumbing in your house. If the pressure in the pipes is too high, the joints start to leak, the water heater might blow, and eventually, the whole system fails. Your medication is designed to be the pressure valve. Some drugs, like ACE inhibitors, work by relaxing your blood vessels so the pipes get wider. Others, like diuretics, reduce the total amount of fluid in the system. But here's the catch. Your body is a biological machine, not a metal pipe. It fights back. When you try to lower pressure, your kidneys or your nervous system might try to crank it back up. This brings us to our first major sign that your medication isn't doing its job: the white coat trap and the masked danger. Most of us rely on that one reading we get every 6 months at the doctor's office. You sit down, the nurse wraps the cuff, and you wait. But did you know that for nearly 20% of seniors, that office reading is completely different from what is happening the other 23 hours and 59 minutes of the day? If your medication is working, your pressure should remain stable throughout your daily activities. If you find that your home readings are consistently 10 to 15 points higher than your doctor's readings, or if you feel dizzy and fatigued only in the evenings, your medication may have a trough problem. This means the drug is wearing off before your next dose. Recent research published in the Journal of Human Hypertension suggests that long-acting medications often don't actually last a full 24 hours in older metabolisms. If your morning pressure is high before you take your pill, your medication isn't failing because it's the wrong drug. It's failing because the timing doesn't match your body's clock. The second sign is something many seniors dismiss as just getting older, but it's actually a red flag for medication failure: persistent, unexplained ankle swelling. Now, I'm not talking about a little puffiness after a long flight. I'm talking about pitting edema, where you can press your thumb into your skin and the indentation stays there. While some medications like calcium channel blockers actually cause swelling as a side effect, it can also be a sign that your medication isn't effectively reducing the workload on your heart. When blood pressure remains high, the heart has to push harder. Over time, this leads to a backup of fluid in the extremities. If you're taking your pills but your socks are leaving deep, red grooves in your skin every night, your vascular resistance is likely still too high. The medication isn't winning the battle against the pressure. Sign number 3 is what I call the headache loophole. We've all been told that high blood pressure is a silent killer because it has no symptoms. That is largely true, but for many people on medication that isn't quite working, they experience frequent dull headaches, particularly in the back of the head or early in the morning. This is often a sign of surging. Your body is struggling to maintain a steady state. If you find yourself reaching for aspirin 3 or 4 times a week for a tension-style headache, don't just treat the pain. Check your pressure in that exact moment. Often you'll find it's spiked. This indicates that your current dosage or medication type is failing to suppress the morning surge, the natural rise in blood pressure that happens when you wake up, which is also the time when most strokes and heart adds occur. The fourth sign is the most overlooked. Your medication is working on your blood pressure, but your pulse is climbing. This is a subtle science-backed indicator. Some medications, especially certain diuretics or older vasodilators, can trigger something called reflex tachycardia. Your body senses the drop in pressure and panics, thinking you're bleeding out or dehydration, so it signals the heart to beat faster to compensate. If you notice your resting heart rate has crept up over 85 or 90 beats per minute since starting a new regimen, your medication is creating a new problem while trying to solve an old one. High pressure is dangerous, but a high resting heart rate is its own independent risk factor for cardiac events in seniors. A successful medication should lower the pressure without forcing the heart to run a marathon while you're sitting on the couch. Finally, the fifth sign is resistant hypertension. This is a clinical term for when you are taking 3 different types of blood pressure medications, including a diuretic, and your numbers are still above 140/90. If you are on a cocktail of pills and the needle isn't moving, the medication isn't the problem. The underlying driver of your hypertension is likely being ignored. In many seniors, this driver is undiagnosed obstructive sleep apnea or a high sodium sensitivity that the medication simply can't overcome. A study from early 2026 highlighted that for about 15% of the population, genetic variations in how the liver processes drugs mean that standard doses of common meds like lisinopril are essentially inert. They pass through the system without ever unlocking the receptors they are meant to target. But let's go deeper into why these medications fail mechanically. It's not just about the drug itself, it's about the environment inside your arteries. Imagine trying to push water through a rusty iron pipe versus a flexible garden hose. As we age, our arteries undergo a process called arterial stiffening. This is often accelerated by chronic inflammation. When the arteries become rigid, the shock absorber effect of the vascular system is lost. Your medication might be trying to tell the smooth muscle in those arteries to relax, but if the artery is physically encrusted with calcium deposits or stiffened by cross-linked proteins, there's only so much a chemical signal can do. This is why we see isolated systolic hypertension so often in seniors, where the top number is sky-high, but the bottom number is normal or even low. If your medication only addresses the volume of blood but not the stiffness of the vessel, it's like trying to lower the pressure in that iron pipe by just turning down the faucet slightly. The structural issue remains. This brings us to a massive breakthrough in 2026 research: the role of the glycocalyx. Most people have never heard of this, but it's a microscopic hair-like lining on the inside of every blood vessel you own. It's the Teflon coating of your circulatory system. When this coating is healthy, blood flows smoothly, and the vessel responds perfectly to medication. But when the glycocalyx is damaged by high sugar, stress, or processed oils, the vessels become blind to the medication's signals. This is why some people can take the highest dose of a drug and see no change. Their internal sensors are literally covered in biological gunk. Restoring this lining through specific phytonutrients, like those found in seaweed and dark berries, is becoming a cornerstone of modern hypertension management. So, if you recognize any of these signs, what does the newest research say you should actually do? It's not just about asking for a higher dose. In fact, polypharmacy, taking more and more pills, often leads to more side effects like falls and brain fog in seniors without necessarily lowering the risk of stroke. The 2026 guidelines are shifting toward precision timing and lifestyle synergy. First, let's talk about the bedtime breakthrough. A major trial recently confirmed that for many patients, moving just one of their blood pressure medications from the morning to right before bed significantly improved 24-hour control and reduced the risk of cardiovascular death by nearly 45%. This is because it targets the pressure during sleep, which is the best predictor of long-term health. When you sleep, your body is supposed to dip, a natural 10% to 20% drop in blood pressure. If you are a non-dipper, your heart never gets a break. Bedtime dosing can fix that. Second, we have to talk about the hidden salt factor. I know you've heard eat less salt 1,000 times, but here is the new science. It's not about the salt shaker, it's about the sodium-potassium ratio. Research shows that for your medication to work effectively, your cells need potassium to balance the sodium. If you are low on potassium, which many seniors are due to certain diuretics, your blood pressure medication will struggle to keep the vessels relaxed. Think of it as a tug of war. Sodium pulls water in, increasing pressure. Potassium helps flush it out and relax the walls. Increasing your intake of potassium-rich foods like spinach, avocados, and beans can actually potentiate or boost the effectiveness of your existing meds. It's like giving the pill a helping hand. Third, the impact of nitric oxide. As we age, our blood vessels become stiffer, a process called vascular calcification. Some medications try to force these stiff vessels to open, which is why they often fail or cause side effects. However, increasing your natural production of nitric oxide through things like beet juice or leafy greens helps the vessels become more compliant or stretchy. When your vessels are stretchy, your medication doesn't have to work nearly as hard to lower the pressure. There's even evidence now that short 10-minute bursts of sunlight can trigger nitric oxide release in the skin, helping your medication do its job better during the day. Now, I want to address something very important for my viewers who are concerned about their kidney health. Many of you are on meds that can be hard on the kidneys if the dosage is too high. This is why the latest medical consensus is moving toward low-dose combinations rather than high-dose single drugs. If your current pill isn't working, the answer might be adding a tiny amount of a second type of drug rather than doubling the dose of the first. This synergistic approach often has fewer side effects and better results because it attacks the high pressure from two different biological pathways at once. It's like using two small keys instead of trying to force a giant one into a rusted lock. Another factor we cannot ignore is autonomic balance. Your nervous system controls your blood pressure through the fight or flight and rest and digest branches. Many seniors are stuck in a state of high sympathetic drive, meaning their body is perpetually prepared for a threat that isn't there. Stress, poor sleep, and even chronic pain can keep this system dialed up. If your nervous system is constantly yelling, "Tighten up," to your blood vessels, no amount of medication will be able to fully counteract that signal. This is why we're seeing such incredible results from vagus nerve stimulation and deep breathing exercises. These aren't just wellness trends, they are physiological tools that change the biochemical environment your medication operates in. Furthermore, we need to look at the stiff heart syndrome, or HFpEF. This is heart failure with a preserved ejection fraction, and it's becoming an epidemic among seniors. In this condition, the heart pumps fine, but it's too stiff to fill up properly. If you have this, your blood pressure medication might look like it's working on the cuff, but you still feel short of breath when walking upstairs. This is a sign of internal pressure failure. The 2026 data suggests that specific medications, like SGLT2 inhibitors, originally for diabetes, are far more effective at treating this than traditional blood pressure pills. If you feel winded but your numbers are 120/80, your medication isn't giving you the full protection you need. Demand better for your heart. I want to be very clear. Never ever stop taking your blood pressure medication cold turkey. That can cause a rebound effect where your pressure spikes to dangerous stroke-level heights. The goal of this video is to give you the vocabulary to talk to your cardiologist or primary care doctor. If you are experiencing cold hands and feet, strange dreams, a nagging dry cough, or if you simply feel off despite your numbers looking okay on paper, you need to advocate for a change. Your health isn't a one-size-fits-all prescription. Your doctor only sees you for 15 minutes. You live with your body every second. You are the expert on how you feel. Trust that intuition. When you combine your personal experience with the latest 2026 clinical data, you become an unstoppable force in your own longevity. Don't settle for fine when optimal is within your reach. Your future self will thank you for being bold today. As we wrap this up, remember that blood pressure is a dynamic thing. It changes based on what you ate, how you slept, and even how you're breathing right now. The medication is a tool, but you are the operator of the machine. The science of 2026 is showing us that we have more power than we thought to manage this condition through a combination of smart monitoring, precision timing, and foundational nutrition. We are moving away from the era of take this pill and call me in 6 months and into an era of proactive, data-driven health. We are moving toward a future where we don't just treat numbers, we treat people. This shift means that you are no longer a passive passenger in your own healthcare journey. You are the navigator. By understanding these 5 silent signs, you've already taken the most important step toward preventing a crisis before it starts. Knowledge is the ultimate preventative medicine. If you found this breakdown helpful, please hit that like button. It helps us get this science-backed information to more seniors who might be struggling with their medications. And don't forget to subscribe. We have a deep dive coming up next week on the top 3 foods that can actually interfere with your heart meds, and you won't want to miss that. We'll be talking about everything from grapefruit to green leafy vegetables and how they interact with common prescriptions. We will also explore the supplement trap, those over-the-counter additions that might be sabotaging your prescription's hard work without you even realizing it. Your journey to optimal heart health is a marathon, not a sprint, and having the right data makes all the difference. I'm honored to be part of your health team. Keep an eye on your numbers, listen to your body's unique language, and I'll see you in the next one. I want to hear from you in the comments. Have you ever felt like your medication just wasn't doing what it was supposed to? Did you switch brands or change the timing and see a difference? Your stories help this community learn and grow together. We see your comments, and they often inspire our next deep dive research sessions. This channel is built on the questions you ask and the challenges you face. Keep an eye on your numbers. Listen to what your body is telling you through those subtle signs, and keep taking those steps toward a longer, healthier life. Your heart works hard for you every single second. Make sure you're giving it the right support in return. It's never too late to optimize your health, and the science is finally catching up to give us the tools we need. I'm so glad you're here on this journey with us. Take care of yourself, take care of your heart, and I'll see you in the next video.